The following podcast is a deep, shallow dive production.
And you're going to love it.
Okay, let's go.
Has anyone noticed that if you fly the American flag, everyone knows who you're voting for?
That's hilarious. I had to start off with that. That's a clip from this guy. His Instagram and TikTok handle is DateRightStuff. And it's actually an online dating site that he owns, I guess for right-leaning conservatives. But you may have seen this dude. He's pretty amazing, actually. He's a, kind of a white dude, clean cut, good-looking guy. And he's gone completely viral with these incredibly insightful 5 to 25-second clips that he does, and normally he's like eating food while he does it. It's literally like he's with his wife or girlfriend or whoever, and he's like, "Okay, honey, here, just turn the camera on, take a video of me," and he'll drop a nugget of information that honestly is, I mean, for the most part, I don't care if he's a right-leaning conservative. Most of the things he says they're incredibly insightful. And what blows me away is the dude's got like millions of followers and millions of likes. It's amazing, actually. And he puts like minimal production time. Like minimal production time. I literally spent all weekend filming and videoing different things for the podcast. I'm not kidding. I probably put in like 10 hours a day, 3 days in a row. And this dude is just like flipping the camera around and dropping nuggies, and all of a sudden getting millions of views. Anyway, pretty funny. But I liked that one because if you remember a few episodes back, I kind of said the same thing. It's like, man, how crazy is the country right now where if you fly an American flag, you are like labeled a Republican, or you're labeled, I mean, it's even one step further. You're labeled a Trumper. And I wanted to bring this up again because I guess Trump was also in Newport Beach, California over the weekend. I had a few friends who went and they're like, "Are you coming?" I'm like, what would make you think I'm coming to that? Like, no, I'm not coming. I'm not that. I mean, again, I like some of the things he does and some of the things he stands for, but I'm not going to go to a rally and wear a hat. I might wear a hat, but no, actually, I wouldn't wear a hat. I wouldn't go to one of his rallies. I'm not all in on the dude. I've never been all in on the dude. And so anyway, but it was amazing. Like the rally was insane. I mean, it was insane. They sent me videos. It was absolutely bonkers. And the bigger point of all of that is that, seriously, like if you're a Democrat right now or an independent, are you not allowed to fly the American flag? It's not that you're not allowed, but are you not going to fly the American flag? And I know you don't hate America. You know what I mean? Anyway, I heard that clip from that dude, so I just thought it was interesting. I mean, I do think that I don't even know what to call it, but that concept, seriously, it's like Democrats and independents even are probably scared to fly the American flag. That is a shame. That is seriously a shame. All right, let's switch gears. So I want to spend probably the rest of this episode going through an interview from Dr. Kathleen Ruddy. She is a surgeon, researcher, and author, and she had an incredible, and by the way, like super, super legit, very, very respected in the medical community, incredibly vetted in terms of her intellect and knowledge base. She's probably most well known for her book, The End of Breast Cancer, A Virus and the Hope for a Vaccine. And so, this lady is incredibly incredibly well respected. She's trained at the Memorial Sloan Kettering Cancer Center. She's the founder and medical director of the Clara Moss Medical Center for Barnabas Health. She's the founder of Breast Health and Healing Foundation, and she is an esteemed member of the Leadership Council of the Harvard School of Public Health. Anyway, I wanted to start off with her bio just to, again, assert her legitness in terms of things, and then go through an interview that she did, which really gives her take on ivermectin, which obviously has been a highly controversial potential solution for COVID and now for long COVID. And so if any of you have long COVID, I hope you don't, because man, that's not fun from what I understand. Or if you know anyone that has long COVID, I think this will be incredibly interesting, especially for you, but I think it'll be interesting for all of us.
I'll have to say that I was as astonished as anyone might be that ivermectin has potential as an anti-cancer agent. I'm a cancer surgeon. We don't do parasites, okay? We don't do ivermectin. And I was not really even familiar with those people who use ivermectin.
All right, let me jump in real quick. So this interview is going to really touch on ivermectin for a few things. And one is obviously, potentially using it for cancer, aiding in cancer. Now, remember, ivermectin, that's a drug that's been around forever, and I'll define it here in a little bit. But I will tell you this, it is not a highly profitable drug, that is for sure, but it really came into the forefront in terms of the COVID stuff.
And so when, in the early days of COVID, when it became clear that ivermectin was effective in preventing and treating patients with a SARS-CoV-2 infection, I began to be aware, having looked in the literature, that there was 20 years of research showing that ivermectin had great potential in the treatment of cancer.
All right, let me actually define ivermectin and make sure we understand what we're talking about. So I asked our good friend ChatGPT, and here's what it came back with. Ivermectin is a medication that's primarily used to treat various types of parasitic infections. It is effective against a range of parasites, including roundworms, threadworms, and other types of worms, as well as external parasites like head lice and mites that cause conditions like scabies. Originally developed as a veterinary drug, ivermectin was later found to be safe and effective for human use. It works by paralyzing and killing the parasites, thus helping to clear the infection. All right, so then remember Joe Rogan took ivermectin. It cured, I think it really did cure his COVID in like 48 hours, and that's when it got all the notoriety as a potential cure for COVID.
I was introduced to a patient with stage 4 prostate cancer. Had received 2 vaccines, perfectly healthy, marathoner, no history of cancer in the family.
She said it kind of fast, so just make sure you listen.
Had received 2 vaccines, perfectly healthy, marathoner, no history of cancer in the family.
All right, so pay attention. This is where it gets even more interesting.
2 months after his second Pfizer shot, he works for the government. He's going to lose his job and his pension if he wasn't vaccinated. He was diagnosed all at once with stage 4 prostate cancer.
So she said 2 months after his second Pfizer shot, he was diagnosed all at once with stage 4 prostate cancer.
He tells a very compelling story, melodramatic story about that 24-hour period of time in his life. And he went through the traditional protocols: radiation, chemotherapy, pharmacologic castration.
I had to look up pharmacologic castration, because as soon as I heard castration, I was like, ooh, that's not good. But pharmacologic castration is chemical castration. It's a medical treatment that uses medication to suppress or reduce the production of sex hormones. particularly testosterone. So they did not chop off his nut sack. I thought that's what they did, but they did not do that.
All of it, over a period of 9 months. And then his doctor said, there's really nothing else we can do. And his name is Paul Mann, and he was like, can't you give me more radiation? No. Can't you give me more chemo? No. Aren't there any other drugs? No. Are there any clinical trials? There's nothing.
I'm actually surprised she gave his name, but can you imagine what this guy is going through? You ask those standard questions. More chemo? No. More radiation? No. Any more drugs? No. Any clinical trials? No. Man, that must have been incredibly difficult.
Hospice. Send for the priest.
By the way, I'm trying to either get on a guest or I'll do a specific episode on hospice. I'm not a fan of hospice. I'm really not. I'm not going to get into it much, but anyway, I think that's an interesting episode. If anyone has any experience with hospice, please reach out to me.
So a friend of his knew me, and she said, would you give Paul a call? He just needs some moral support, something. So I said, sure. So I began calling him. We spoke about once a week for 3 weeks, and finally, the poor guy was suffering. He had cancer in 11 bones in his body. His right leg was completely swollen, obstructed with tumor. He was miserable. And I said, Paul, I don't know if this is going to help you, but I know it's not going to hurt you. I just can't imagine, based on my judgment and understanding of the scientific literature and all of the work that Drs. Corey and Merrick had done, and others around the world, that ivermectin would hurt you. It might help. I can't say. So he said, I'll give it a try. And he drove to Tennessee where you could get it without a prescription.
Being the natural-born skeptic and natural-born killer that I am, I looked it up. I wanted to see, has this been in the news and all that? And it totally has. The FLCC Alliance on today's Cancer Practical Solutions with Dr. Paul Merrick, Dr. Nathan, Dr. Goodyear, and Dr. Kathleen Ruddy. Paul Mann shared his incredible story. Damn, I kind of already ruined it. My bad.
P.S. I discovered last night, having dinner with Paul and his wife, Terry, he drove from where he lives in Missouri to Tennessee and paid cash for his ivermectin. That's it. He didn't submit it to an insurance company. He didn't tell anybody back in Missouri as oncologist. No. His ivermectin prescriptions are listed in his chart. How did that information get from the pharmacy in Tennessee to his chart in Missouri?
Okay, that's interesting for two reasons. First of all, I love that Paul Mann took his health in his own hands. I always kind of talk about being your own primary care protector. Actually, I don't think I've talked about that on this podcast, but I did write a guide about that, which I'll be releasing here shortly. But anyway, I love the fact that he took the bull by the horns and he's like, okay, these doctors are telling me there's nothing that can be done, anything, and to call in hospice and to call my priest, screw that. I'm going to try something. So he drove there and got his ivermectin, paid cash for it. But then the second weird part is, how does that end up on his medical chart?
We don't know. Somebody does. I'd like to know myself. Anyway, he starts taking ivermectin, and he doesn't have any problems with it. And I talk to him every week. And how are you feeling? Well, no change. Next week, maybe a little bit better. I don't know. How's your leg? It's not quite as swollen. How's the pain? Pain everywhere. Maybe a little bit better. Slowly. Not getting worse. Not necessarily getting better, not getting worse. Fast forward. 2-month follow-up appointment at the clinic. They didn't expect to see him. Okay, he's like, Paul. He's feeling a little bit better.
So again, just so you're clear, so basically he's been taking ivermectin for 2 months at this point.
They do PSA, which was off the charts to begin with. And if I'm not mistaken, at the time they randomized him to hospice, I think it was in the hundreds, maybe 700, 800.
What does that mean exactly for the layperson?
Over 4 would be abnormal. Okay, so what are we talking about here? Prostate cells normally secrete a protein, prostate-specific antigen. It's one of the things that they do. Cancer cells that originate in the prostate that are dividing rapidly and growing fast are spitting out PSA, okay? It's not that they're contributing to the body economy in any way. It's just they just want to multiply and divide, and that's the end of the story. And so your PSA levels start to rise, which is a marker, a screening marker. Oh, your PSA was 4, and now it's 8. Let's do a prostate ultrasound, whatever. So PSA can be a screen for the emergence of a tumor, but it can also be used, particularly at high levels, as evidence for cancer, response to cancer, recurrence of cancer. His was, I mean, it's supposed to be, 4, yeah, it's hundreds.
By the way, for those of you that, follow the DSD protocol, the DSD protocol, that was funny. But anyway, if you get your annual blood test, man, I can't believe we're 6 months into the year, but they should always measure for PSA, and you should have a number next to your PSA. I think when I got mine, it was 0.7.
Okay, he goes back for his 2-month appointment. It's 1.3. They said, you're in remission. Well, not, complete remission. He still had the bone mets, but you're in like a biochemical remission. Well, that was good news. Slowly, he begins to improve. Less pain, swelling is okay. A lot of other vaccine injuries, however.
By the way, this is another case of, I have not listened to this entire clip, so I don't know where she's going with this part of it. But again, listen to this because it's important, and I appreciate her for talking about this.
A lot of other vaccine injuries, however. He's getting better. We're giving him nutritional support and other supplements. He's having TIAs, little mini strokes.
All right, let me jump in real quick because I've got experience with TIAs. Oh my gosh, my mom had one actually, and this was back in probably 2005. So I want to share this because I want you to be aware of it in case any of your loved ones has one. But basically, a TIA is a transient ischemic attack, and it's often referred to as a mini stroke. Here, I'll read this to you. It occurs when there's a temporary reduction or blockage of blood flow to a part of the brain, resulting in stroke-like symptoms. Unlike a full-blown stroke, the blockage in a TIA is brief, lasting typically only a few minutes to a few hours, potentially even just a few seconds, and does not cause permanent damage to the brain tissue. So this is kind of crazy. It actually can happen in different kinds of scenarios. And 2 of them, which I found was odd, was cold water immersion. Jumping into a cold pool can cause a sudden constriction of blood vessels and a spike in blood pressure, which might trigger a TIA. Sexual activity can increase blood pressure and heart rate, potentially leading to a TIA in individuals with predisposing conditions such as hypertension, arteriosclerosis, or other cardiovascular injuries. So really quick in my mom's scenario, she was under a lot of emotional stress for whatever reason that night. And then all of a sudden she kind of grabbed the back of her head, and right after that, it was like she was just lost, okay? And so she didn't faint or anything like that. I thought she went into shock for some reason. And we were actually out at a restaurant, believe it or not. So long story short, she ended up suffering like temporary short-term global amnesia. So she literally could not remember those few hours. And we took her home. I had a doctor friend come over, and he basically, ironically, I diagnosed it as a TIA in the car ride home. And then he said she's had a TIA. So long story short, she's fine. She ended up being fine. We got her totally checked out. No long-term anything. But the biggest tell sign was that She kept on asking the same questions over and over and over again that night. And literally, like I said, to this day, can't remember that chunk of like 3-hour time. Like she didn't remember being at the restaurant. She never to this day has remembered being at the restaurant, obviously what happened. And then she really didn't even remember much of that night. So anyway, these TIA attacks, they're very subtle sometimes, but if you have a loved one that has, you know, a situation where all of a sudden they're just acting differently, like dramatically differently, and there is a loss of memory, short-term memory, or they seem confused, it could be a TIA. Let me read you a few more symptoms. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, and understanding speech. That's a little bit what my mom had. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Or sudden severe headache with no known cause. So, you know, TIAs are really important because they're kind of a indicator of a potential future stroke.
But he didn't tell me about that because we were talking about the cancer. But over a period of time, I'm asking him questions. And I said, "Oh, you're having TIAs?" His wife said, "Yeah, having TIAs." I said, "What do the cancer doctors tell you?" Because that's who he's seeing. They say it's not related to my cancer. It's like, so I get a call from his wife one evening. He's in the emergency room. He's had this TIA, whatever it is, catastrophic. And I said, "Paul, what are they doing for you?" And he said, "Well, they did a CAT scan of my head, and they said they don't see anything specific. It's a TIA, and it's not related to my cancer." They send him home. I said, "Did they do anything?" "No." I said, "Well, okay. Call me crazy. I'm a cancer surgeon, but I think you need to see a cardiologist. I think there are things they can do," okay? And, of course, I look it up really quickly, and of course, there are things. So get him to the cardiologist, get him on blood thinners, no more problems with TIAs, okay? That's an indictment of the healthcare system.
That was pretty hardcore that she said that's an indictment on the healthcare system. Man, that was interesting word choice. But I will say the blood thinners, you know, that is a great call in a lot of situations because, again, that's potentially what helps prevent a stroke or a heart attack. That's why a lot of people take a baby aspirin when you get older. It's like the 81, I think, milligram baby aspirin. It's like they literally call it a baby aspirin.
So he's getting better, but 9 months later, he's out dancing for 4 hours, 3 nights a week. He gets a head-to-toe rescanning, and 3 of the bone mets are gone. There's no growth of the mets that are there, no new lesions. There's only one hot spot, and that's where he received radiation therapy, and the radiologist really could not distinguish whether that was a tumor hotspot or radiation change. He is doing very well. Now, the vaccine injury is a problem, but the cancer is no longer a problem except for the fact that it's still there, and we want to get rid of it completely. And he said, he called me from a hockey game, and he said, "If I didn't know I have cancer, I would not know I have cancer." That was patient number 1. I was like, that's interesting. A second patient crossed my path. A guy in his 70s who had been losing weight for a year and a half, 40 pounds, not vaccinated.
Okay, I did want to make sure you heard that. This is patient number 2, and he's not vaccinated, okay? She said not vaccinated.
40-pound weight loss, smoker, drinker, all he does is fish. And he could no longer swallow, and he could hardly talk. And so I got on the phone with him, and I said, "Eddie, you know, tell me a little bit about your history," and so forth. He knew someone with prostate cancer who had taken ivermectin. He cured himself from prostate cancer with that. So Eddie began taking ivermectin. I have no idea what the dosing was. He was just taking it. And I gave him some advice about diet and, you know, try and get the weight back on and so on and so forth. Within a couple of weeks, he sounded stronger. Sounded stronger. He could swallow. He had gained 6 pounds. His voice was better.
I mean, this is interesting. And again, I wanted to make sure you did hear that she said this guy was not vaccinated, because this is not about, I mean, honestly, it's not about the vaccine. It's about ivermectin. And it's about a drug that, really has been so chastised because there's no money in ivermectin. There's really no money in ivermectin, but it seems like it really potentially, does incredibly good. Now, again, I know this is only 2 cases, but when someone like Dr. Ruddy comes and talks about this and is willing to kind of stake her reputation on this, I think it's worth listening to.
Followed him for the next couple of weeks, maybe another month or so, and I said, Eddie, we need to get a scan. He doesn't have insurance, he doesn't like doctors, whatever. He had been diagnosed in that interval with 2 esophageal tumors, unresectable. Surgeons wouldn't go near it. The doctor said, well, we'll give you chemo and radiation, and Eddie said, no, you're not. So he takes his ivermectin. Maybe about 6 weeks later, I said, Eddie, you need to get a scan. I had to argue with Eddie to get a scan. We got the scan.
Eddie sounds like kind of a knucklehead, but drum roll. Brrr. So what happened, Dr. Ruddy?
No tumors. Gone. Gone.
That was pretty interesting. I hope you guys enjoyed that. Again, that's another video. Actually, that kind of went viral last week. I had it saved down to my phone and just looking for the right opportunity to share it. So anyway, again, I mean, I know that's only 2 cases. I get it, and I'm not really trying to assign blame to anything, nor am I trying to truly give credit to everything, although I am giving a little credit to ivermectin. But my point is, if you've got something going on medically, you got to look at it from all sides, and there might be solutions out there that might not be being advocated. And so again, take your health in your own hands. Think about things outside the box. It's your health. For a doctor or anyone to say, sorry, there's no other choices, hospice, call your priest. I mean, that is, again, I get it, but man, that is like cold and insensitive. Although, again, I get it. I do. I really do. I'm not making an indictment on the healthcare system. Instead, I'm just saying, take your health in your hands. Obviously, your boy is here to help think through anything, which I really am. And, fundamentally, hopefully you don't have any of these issues at any point, but I also want to make sure, the TIA thing is on your radar, so you potentially recognize that in a loved one. We've talked about the concept of sepsis, which is like poisoning of the blood. We've talked about that in a previous health episode, but I will do a deeper dive in that because that's another one that people just don't understand that's happening. And I had experience with that too. My dad had sepsis where basically he had a slow leak in his appendix. I think I mentioned this in that episode, but he had a slow leak in his appendix and he went from hanging out in Palm Springs to literally not being able to articulate a sentence. And thank God my mom called me and I got there in time and I took him, I called 911 and had the emergency vehicle come and take him in. If I had just taken him into the emergency room by foot, we would have probably had to wait several hours. He might have died in the waiting room, or at least he would have fell over and collapsed in the waiting room, and maybe they would have taken him in then. Anyway, hope you enjoyed today. A little bit off the beaten path. We're back. Actually, this was a DSD health episode. What am I saying? Off the beaten path. That is our path. We are into health. All right, everybody. That's all. Have a great day, and we will catch up with you soon.
This episode was brought to you by the new book, Deep Shallow Dive Into You, available now on Amazon and Barnes & Noble in hardcover and paperback. Don't forget to sign up for our new mailing list on our website at deepshallowdive.com.